Hello, Jerome. How you going?
G'day, Michael. Yeah, not doing too bad. I'm just sort of juggling the kids and thought I might have a bit of a chat to you. Thanks for having me on.
Mate, thanks for coming on. Yeah, it's good to sort of touch base. For those of you out there that don't know, I'm sure everyone does know you and you don't need any introductions. This is Jerome, the Mayor of Ryde. Obviously, it's great to have Jerome on board. I'm getting a lot of questions from a lot of my clients locally around Ryde and West Ryde and so on about sort of COVID-19 and what the local area is doing. So it's just great for you to come on board, Jerome, and yeah, have a chat with me about how you're finding things. How's council life going over the last 6 weeks? Obviously, there's a lot of work for you.
Yeah, it's been quite extraordinary. The word unprecedented has been thrown around a lot over the last sort of 3 months, but yeah, it's been quite extraordinary to sort of go through. We were, of course, here in Ryde, we were hit a lot earlier than I guess the rest of the city were, because we had that period in late January and early February where our town centres were ghost towns prior to, the infections sort of coming into our area. So we had that issue down at Eastwood and West Ryde where people were just not going to the shops. This is all prior to, the Ruby Princess.
Yeah, the curving pricing.
The curving pricing. So that we've been feeling the impacts of this since January, sort of mid to late January. Sorry, my son's just come by. I've got to unlock the phone for him. There you go, buddy.
That's all right.
Sorry,
mate,
you can edit that out, maybe.
Home life now, mate.
Home life, yeah, absolutely.
The reality is we're all working from home. I'm in the office this morning, but I'll be home by sort of 1 o'clock, 2 o'clock today. So plenty of home life going on. You mentioned obviously Ryde. So Ryde got hit a lot earlier. We were sort of, I suppose, the first area to unfortunately have the deaths occur due to coronavirus in Macquarie Park and North Ryde. I mean, it must be difficult for yourself, like, to be in the coalface of it all when it first hit. And how did you find it? Like, what was your initial reactions, mate? Because, like you said, unprecedented doesn't describe it.
Yeah. So, I mean, obviously, there's the human loss, and I'd just like to use this opportunity to extend condolences to anyone that's lost a loved one or someone close to them through this period. Unfortunately, some of those, there's a cluster in a nursing home in Macquarie Park and in Ryde Hospital as well. And we know a lot of people that work there and work at Ryde Hospital live locally. So our main thrust at council, I mean, apart from the human element, of course, our main thrust at council was just to ensure that our business to serve our community could still operate and not shut down. So we took measures in place almost overnight to ensure that our key staff didn't get sick, that the councillors separated from one another, because we wouldn't want, our entire governing body out of action for a long time. We took some emergency measures in terms of delegations, and we set business plans, continuity plans in place really quickly, because we didn't know back then, and we still kind of don't know how far this will go, right? So we also then started rolling out a lot of stimulus for our local businesses, and we're about to roll out our first stage of residential rate relief as well, because we're now hitting the crunch. We know sort of what we're playing with, and we know that people are struggling out there, so we want to try and help where we can.
No, that's really good, and great for you to mention. I have had a lot of clients actually talking about council fees and things like that, and what's going to sort of happen moving forward with a lot of that, with their jobs being impacted and things. I suppose, obviously, you mentioned responses. Like, what were some of the responses that you sort of jumped onto straight away? And I mean, like you said, there's not really any sort of certainty around how long these things are going to last. But now that the curve's starting to sort of lower a little bit, and obviously we're seeing some great successes out there. I mean, obviously we still want the community to sort of abide by those restrictions. Is that correct?
Yeah, absolutely. So, I mean, look, first piece of advice is please just follow the health orders and the advice from health professionals. I'm no doctor, but I defer to our health professionals and our state government who manage health crises here in New South Wales. So whatever they say goes. And we had to respond almost daily. There were different rules early on there. Now it's kind of been a bit stable, so we know what we're working with. But early on there, we were, one day we restricted the amount of people that could go to our libraries. And then the next day we restricted it to computer use only, because a lot of people go to our library because they don't have a computer at home. They don't have access to the internet. So they go to the library to do that. So we said, all right, well, no borrowing books because you're touching it and stuff. So let's just restrict it, keep it open just for people who want to use computers. And then the next day we had to shut libraries. Then we had our swimming centre, and of course all the swim schools that we had to pass. We had to put out on public exhibition rules to refund all those fees because according to our fees and charges, we weren't allowed to refund them. So there are a whole heap of legislative loopholes we had to jump through and navigate and work through early on. But we've got through that now, and we're in recent times I've reached out to New South Wales Health. There's talk of setting up a drive-through COVID clinic here in the Ryde area. Mm-hmm. So my staff are working with them to try and if they need one of our sites in terms of a hall or a car park or something that council owns. Then we're happy to give that to them to use because unfortunately they're empty at the moment. Our halls are also closed. However they can be used to get us through this, we're more than happy to assist with the state government in doing that.
Yeah, no, that sounds good, mate. I have heard a few rumblings along the traps about drive-through test stations being in Ryde because it was the original Epicentre and so on. But I mean, one thing that I'm getting a lot of questions about in the community, obviously leading up to this Saturday, it's Anzac Day this Saturday, and there's usually some pretty big services on in the Ryde community, and you're usually sort of at the coalface of a lot of it. What is sort of Ryde Council and the community going to be doing this Saturday?
So we're going to start encouraging people this week. The RSL are doing there's dawn on your driveway. So they're encouraging people to grab a candle and at dawn, 5:55, I think it is, just pop down to the end of your driveway and have a couple of minutes to reflect and commemorate those who've been lost. This will be an Anzac Day like no other. Usually we're down at West Ryde. The council run service is down at West Ryde. It starts at 9 o'clock. It's really family friendly. It's only been going for a couple of years. That was something that I worked on bringing in because, as you saw earlier, I've got young kids and it was hard to get them out to the 5:30 one up at North Ryde. So I'm just like, we should put something on at a family friendly time. So that's not going to happen this year, which is a real shame. I've enjoyed bringing my kids to that so they could get a bit more of an understanding. So what the RSL are promoting and what we'll start promoting on our socials this week is to encourage people to commemorate in their own way. I think there's a whole heap of stuff that's being live streamed at 5:55. You can get to the end of your driveway, hold a candle. This will be an Anzac Day where more than ever we'll connect with one another via social media,
exactly.
You're down at the end of your driveway, take a photo, post it, and that might spur someone else on to take 5-10 minutes to do a bit of research on Anzac Day or explain to their kids what it's about. And that's, I suppose, the point of all this stuff, that we don't forget what those before us have sacrificed, and that we instill that sort of Anzac spirit in our kids. So
definitely.
I'd suggest you guys do.
I think the driveway thing is an interesting one because I've had a lot of people mention that, which is really good, and I've been trying to sort of promote that to a lot of my clients and sort of still get involved. And I think a lot more people potentially could get involved in an end of driveway dawn service because it's not too hard to get out of your bed and go down to the end of your driveway compared to going down to the park as well. So there's a few positives that might sort of, like you said, create more community interaction from social media and things. And also the last post,
you could even do it in your pajamas if you really want to. I mean,
100%.
It's strange times, but normally I'd say put a nice outfit on. But look, I think let's give it up this way. You can head down in your pajamas and commemorate.
Mate, and those that don't wear pajamas, make sure they put some on before they go to the end of the driveway.
Absolutely.
Definitely. But mate, obviously there's a lot that's going to be changing over the next 3 months and sort of pushing forward with this thing. Is there any sort of foreseeable changes that you think is going to happen in the local community? Like, is there anything that you think is going to be brought in that's on a permanent basis, I suppose, as a result of this and what's happened?
Look, if you asked me in January, we would be here in April. No one could have predicted that, right? We don't really know what's happening. We're seeing cases overseas where they had the curve flattening and then it's just spiked up again, and that's always the risk. So for now, and as I said, I've got full confidence, apart from one or two issues, but I've got full confidence in what our authorities are saying, and I think that's the only option we have for now. But I'd really like to praise and encourage our local community for what they've done. We've seen a real flattening from being the epicentre, right, at the start. This is where sort of we started having a lot of transmission in the nursing homes and Ryde Hospital. We're now outside the top 10. I mean, not that it's a positive top 10, but there's a list of local government areas out there, and Ryde was firmly entrenched in the top 10 early on. But what we've seen, thanks to you and thanks to our community, is that that's really flattened locally. We've only had 11 new cases since the start of April. We're hovering around 65 and 66 confirmed cases. And the reason why we're a hotspot is not because of the number of cases that we have, it's because there has been a small amount of community transmission. So in terms of case numbers, we're doing enormously well. And in some instances, some days it actually goes down. And as I said, we've improved from being, number one early to well outside the top 10, and that's thanks to your clients, and to people in this area. So I'd like to encourage you to continue doing what you're doing. Over coming months, we'll no doubt see some relaxing of restrictions. The Premier's talking about sending kids back to school on the third week of May. Second week of May, which is the third week of term 2. So, we'll monitor that. And as a parent, I'll monitor that as well. And we want to make sure that not only our health, but our community health is paramount. And I'm raring for things to go back to normal, Michael. I'm an introvert and I'm struggling. I can't imagine how extroverts are doing.
Right, exactly. I know you pretty well, and I knew you were going to be struggling sort of sitting inside. As much as we get to spend more time with the kids, obviously interacting with the community and stuff. That's what we love, and that's why we love the jobs that we're in. I think the other thing which I wanted to make a real point of, which I think the community is doing really well of, is business is unusual, but it's still going on. And that's one thing we've established at McGrath, is that we're still doing business, and there is still clients that want to buy and sell real estate, and we're still selling properties and so on. We're doing it obviously by the restrictions and social distancing and things, but there's local cafes and local restaurants, and everyone's having to adapt. And there's a lot of Uber Eats, there's a lot of self-delivery, safe delivery. There's a lot of things happening. So I just want to make sure, and you're doing a great job to get it out there on your social media as well, with all the local cafes and restaurants and people who are harder hit at sort of this time. It's awesome to see the local community supporting local as well. I think that's pretty cool. So I hope everyone keeps that up.
Absolutely. It's vital that, people tell us what they love about Ryde is our local vibrant town centres. So whether it be Blenheim Road shops or Cox's Road or, down at Eastwood or West Ryde, they love the vibrancy. They love popping down there and grabbing a coffee or grabbing a meal or just browsing the shops. And unfortunately, we can't do that at the moment. But what we also want to make sure is that we continue to support these small businesses so that when things are back to normal, that they're still there and that those shops aren't empty and that those shops aren't boarded up. So that's why we've released a lot of stimulus for the tenants of those businesses to try and get them through this. And, it's been followed now by state and federal support, which is welcome. But, we want to make sure that coming out of this, we're not going back down to midway shops and that there's no tenants there and that there's no vibrancy, because I think that'd take a long time to replace. So, that's where we can step in a lot more. We're only a council, like we're not awash with revenue as much as the state and federal government, but, we're trying to target our support and we're trying to make sure that we retain what people love about our city. And be that our local parks and playgrounds or our local strip shopping centres or whatever it is, that's what we're going to try and hold on to through this. Yeah,
good. No, that's fantastic. I suppose one more quick question before I leave you, mate, is a lot of our clients are still asking about LEP changes and things like that. Obviously, we keep sort of saying to a lot of clients that I highly doubt there's going to be a lot of changes over the next few months because of what's happening out there in the global scale of things. But yeah, is there any updates on any of that you can share with any of our clients as far as sort of changes in duplex laws or development laws or anything like that?
Sure. So as far as we're aware, it's still full steam ahead from the Department of Planning. I understand that they're obviously a bit under-resourced at the moment, and that's not their focus. But the state government's medium density housing code is still due to come into force on the 1st of July. That hasn't changed. What Ryde has done is we've lodged a planning proposal to ensure that we're not hit with the worst effects of that but ensure that our community are able to take advantage of it if they want to. So what we've done is we've asked the state to look at our proposal to remove multi-dwelling housing from the low residential area, which is had we left that alone, what we would have seen is basically duplexes on every block of land in Ryde. Which I love duplexes. I think they're a great housing choice, but I don't think they belong everywhere. So what we've put out is an application to the state government, which is early days. So we're looking to seek public exhibition of that in the next couple of weeks so that it can be enforced by the 1st of July. So keep an eye out on my socials. I'm sure you'll learn a bit more about it once it goes out to public exhibition. So we're proposing on removing that multi-dwelling use out of low density. And then what we'll have to do is look at some areas around the city where we can sort of target where that multi-dwelling is. We're still beholden to state targets, and that's how the housing supply system works in New South Wales. As the state say, you have to provide 15,000 new dwellings in the next 20 years, then that's what we have to do. Or else we get sacked. So it's one of those things. It's we push hard and try and get our infrastructure up to scratch, and what we're responsible for we deliver. But where we found a bit of a disconnect is sort of that state and federal infrastructure that's kind of been left behind. So we're working really hard to ensure that, as I said earlier, how people love our local shopping centres, people love our low density quiet streets, and we want to make sure that Ryde retains that diverse housing stock, so you can still get your big house on your block of land, but then if you want to come into the entry level in Ryde, you can grab a 2-bedroom townhouse, or you can grab a 2-bedroom apartment, which is what I did. I started in a 2-bedroom townhouse. It's all I could afford when I first got married, and then once we started having kids, we jumped up to a small house, and then we're able to fortunate enough to improve on that. So and that's, we want to make sure that continues here in Ryde. So we not just have one type of housing stock, we've got that diverse type, whilst also trying to keep a lid on going too far one way. And I think what we've seen recently is there's too many apartments and not enough medium density. So what we're trying to do is recalibrate that. The apartments were put in by previous councils and by the state, and what we're trying to do is slow that down and provide housing stock in duplexes and villas and stuff. So
excellent.
That's kind of where we're at.
Yeah, thanks for the update. Like that'll help out a lot of our clients, understanding that it still is pushing forward. But there's sort of going to be updates over the next few weeks anyway, so we'll keep everyone informed, and mate, we'll go from there. But,
I mean, they could come out tomorrow or after you publish this and say we're gonna pause that for another 3 months. So we just everything's fluid at the moment, but we've lodged our documents, and once we get the okay to exhibit it, we will, and I'll be in touch, or give me a buzz when that happens, and I can talk you through the proposed changes. And there'll be a process of public consultation, so that people can have their say on the plan, and then we'll send our recommendation to the state government.
Awesome, mate. Well, thanks for coming on today, and I won't take up too much more of your time, mate. Get back to the kids and get back to doing some work, and we'll go from there.
No worries. Thanks,
Jerome. Take care, mate. Bye.
Cheers. Bye.